back to our YouTube channel. I am Princess.
And I'm Jazmin.
And we are White Coats and Stethoscopes. So in this video, we will talk about our maternity rotation. So in our maternity rotation, you're either in L&D or postpartum or the NICU.
Or antepartum.
Oh yeah, or antepartum. It's a 5 weeks, I would say, course right now. In our previous video, we talked about how we have an exam every Monday. And that's the same for this class. So I am loving maternity so far. I'm loving the clinical portion of maternity. I see my first vaginal birth. Hopefully, maybe next week I'll see a C-section. Just seeing birth period, it was just like awesome. It was amazing. That's something I never seen and I wanted to see. And I'm just really enjoying maternity so far.
For maternity, for me, it's like, it's scary. No, seriously, it's just like, oh my gosh, like for the exams, like for theory, I'm doing good because it's just, we're both women. So we know like the certain things about our body, so it helps with these exams. But for clinical, I'm doing good in clinical too, but I seen my first vaginal birth. It was like, we're all hands on deck in there too. Like the midwife is like, all right, like nursing student, I need you to hold the mom's legs up while she pushes.
You prep with sterile?
We're doing the sterile field, taking out Foleys so the mom can push. So I took out a Foley.
Giving fluids sometimes.
Yeah, giving fluids.
Medication. I mean, I commend every mom, like just seeing what you guys have to go through during the process and just after the process too, like just how your body takes time to go back to normal. But we just commend all the mothers out there.
And it's really not even 9 months. It's
I know.
I know Princess wants to be a L&D nurse.
I do.
So
I'm so interested in being an L&D nurse. I love postpartum. My first clinical rotation, I was in postpartum. So basically, it's after the mom delivers the baby, she'll go to postpartum to recover the baby too. And then you have to just monitor the mom and the baby, making sure everything is intact. The mom's not bleeding, the baby is healthy. It's just a lot of assessment. And then labor and delivery is like the process of the baby being delivered.
Watching that fetal heart, monitoring, and then just seeing what's going on, like if it is like a cord prolapse or if the baby's not receiving enough oxygen, we're just monitoring that, and then repositioning the patient. Like for my patient, she was having some, basically the baby wasn't getting enough oxygen. So we had to position her on her left side, and we put a peanut in between her legs, which is like a peanut-shaped yoga ball between her legs just to open up. Right after, it's just crazy how the mom just started dilating so quickly after that.
That peanut ball works. I had the same thing with my patient. You especially use that peanut ball for patients that has epidural because they can't really feel like the pain or anything anymore. So you have to have that peanut ball so they can and you supposed to reposition them every 2 hours. Being in L&D, it taught me how to monitor the heart rate. The baby, because just monitoring the mom heart rate too in the babies, but it's just interesting to see that the baby heart rate is really important. Like it can really decline
too, because when you're dealing with adult patients, we're used to the respiratory rate being 12 to 20. But when you're with basically monitoring for the baby, if you're doing postpartum care, it is 30 to 60 for their respiratory rate, right?
I believe, yeah.
And then their heart rate ranges from 100 to 160. And normally when we're doing adults, we'll just be all right, we did it for 30 seconds, let's time 2. You cannot do that when you're doing a baby. You need to listen the whole time.
That whole minute.
It's so irregular. It can get intense and just a little nervous because you're holding somebody else's child. So just doing the full baby assessment, it's a lot. You're picking this baby up, you're turning them around to check for make sure their spine is midline. You're feeling on the back of their head to make sure there's no overlap. We can just talk about more of that stuff in more detail if you guys want to hear about it, but it's just a lot when we're doing during our clinical.
Like she said, blood pressure, we're doing everything a whole assessment on the mom and baby, the same thing, just making sure that everything for the mom is going back to this normal state, like I said.
And then for theory, for our lecture portion, We learn like a lot in lecture. Like,
Yeah.
luckily we have a professor who
Oh my
is
God.
also an L&D nurse.
We love her.
So we're learning so much from her, and it just keeps us prepared for when we're going to clinical. It's like, all right, I remember her talking about this.
Mhm.
Like, I'm prepared.
Our sim we had for that was like a verbal, like physical abuse on a mom that's pregnant, and how to actually like sit down and talk to a patient where they can actually tell you what's going on, and how to be open and kind of, you know, guide to the patient that there are resources to get out like an abusive relationship when you're pregnant. That was one of the sims, and I was picked for that sim in the primary nurse. So it was a primary nurse and a secondary nurse, and I was the primary nurse for that. And I can say that sim was very emotional, and really it was hard to kind of get through to the patient, because you have to remember that sometimes people that are victim of abuse that's pregnant, you know, they feel like it's their fault and that they don't have no way out. It was just interesting just being in that sim. It was kind of hard and emotional on I think everybody that was watching that was, you know, in the sim. So
What was the sim that we had before that one though?
it was we had like breastfeeding.
Was it breastfeeding? Was that the sim before that one?
Making how to change the diaper on the baby.
Okay, yeah.
It was all that, like hanging fluids, IVs, and stuff like that.
So I'm trying to think, what else have we learned, or what else do we want to share?
I mean, it's been a lot of different things in maternity. I'm just so excited and so, you know, interested about. So we've been doing a lot of things, I think, in maternity. We also did how to give meds. You did that. Reflexes is a big one too in maternity. Making sure the mother has her reflexes and
and baby.
Yeah, and baby, and making sure that the mom, you check mom's legs, you know, make sure there's not any pain. That was like one thing we learned about.
DVT. Like, what are we doing this week? We are having our simulation on postpartum hemorrhage. We just had an exam on it today.
Yes.
And about some like what was it, like postpartum complications were also on our exam. We have one more week left. Today was our last lecture.
Yay!
Right?
Yes, it's our last lecture.
That was our last lecture.
For
we
maternity.
have exam 4 on Monday.
Yes.
And then we have just our last week of clinical, because this is week 4. And then we have, tomorrow we have our simulation, and then we're off for the 4th of July weekend. And then we come back to do our exam, and then we have a full week, and then we're off to pediatrics.
Yes.
And after pediatrics, we are fall semester, second year nursing student.
Hey!
It went by so fast. We're going to
We'll
be officially ELMS 2.
We'll be getting pinned soon. That's exciting.
Yes, and taking our NCLEX in January. So everybody warns us, like, ELMS 2, we're ELMS 1, meaning this is our first year. So ELMS 2 would be like, summer semester is going to kill you. Like, be prepared. It is tough. It's like, I'm sleepy right now. Yeah. I don't know how we doing this video.
Out of all the semesters, I feel like summer has been one of the toughest semesters. So any other videos you would like to see, let us know. We're open to suggestions, and you know,
we have a lot that we can talk about, but we don't want to talk forever or just be talking and they're like, okay girl, we didn't ask for this.
Okay.
So but it's just so much that comes with nursing school that we can talk about, like when it comes to like just trying to maintain like being fit. Because I'm a stress eater, so Princess be seeing me with my chocolate. And she's like, Jazmin.
Like, Jazmin, you don't need that Snickers. Put it
down.
Yes. Or if you
I will get a Snickers.
Or if you moms that's out there that's pregnant or have kids, we have a lot of moms.
We actually have one mom who wants to talk about her experience too. So we'll bring her on one day.
So we'll bring that. I mean, or just like how to balance nursing school in life. Like, we could talk about that. Or if you're going through like any other problems, like
any loss that you may have had, like family members, we can talk about that. We are open to, even a couple of our instructors really support our YouTube channel, so I know a lot of them will, like, maybe they can give you some answers or anything you want to ask them. They're very supportive. And then you guys can see us like in our goofy state.
And we'll like throw some clips of us being goofy, or some of our classmates too. You kind of see a little background of us in class with other people. So stay tuned to that. But thank you for watching.
Yes, thank you.
And we will have our personal page and also our White Coat and Stethoscope page below.
And I'm just
I need to look. Okay,
right.
girl.
And so basically just like, subscribe, and comment and leave us feedback.
And we'll see you next time.
All right.
Bye.